I saw this particular news and it's very worrying. It's a very worrying news concerning about Lamine Yamal. So this is what it was. It is reported. Lamine Yamal diagnosed with chronic Pubalgia injury that can never be cured. In fact, this injury is there, but most of the times we don't normally hear this particular injury. For most people, this is the first time we are hearing this particular injury of Lamine Yamal. It is said that it cannot, or that can never be cured, that Lamine Yamal will have to live with it. And it's so bad, man. Sometimes, how can sometimes I feel like God should just create someone perfect. But Charlie, nobody can be created perfect. You'll be created with some kind of talent and you'll be lacking something else. Now, look at Lamine Yamal. He's just 17 or 18 years of age, and he has already shaped the world with his scintillating and stellar performances, dribbling skills, his movement, his body skills, everything. At the age of 18 years old, he came as second in the Ballon d'Or, only for him to be diagnosed with this kind of injury, and he said it can never be cured. Is it really true that this particular injury can never be cured? So I went on to search to find out more about this particular injury. Let's read together. So chronic pubalgia, also known as athletic pubalgia or a sports hernia, is a chronic groin injury resulting from an imbalance of forces on the pubic bone, causing pain in the lower abdomen and groin area. It is not a true hernia, but involves a weakening or tearing of the abdominal muscles or their attachment to the pubic bone. This condition is common in athletes involved in sports with twisting and turning movement. So this is the symptoms. Symptoms: pain in the lower abdomen and groin area that worsen with activity like kicking or running and improves with rest. It can also be triggered by sit-ups, coughing, or sneezing. Tenderness may be felt at or just above the pubic tubercle. Causes repetitive movement, sudden changes in direction, and overuse of abdominal and pelvic muscles. Could it be because Lamine Yamal has been overused during his teenage age? This is exactly Lamine Yamal kind of play: twisting, movement. He takes the ball, and if he gives you a feint. He's so quick. His reading of the game and how he twists his defenders so quick. So could it be that because he has been overused during his early age? Because he made his first debut at the age of 15. Imagine 15, 16, 17. At some point, he was playing non-stop for FC Barcelona. Could it be because of that it has grown and it has now become more serious that, Charlie, it is impossible to, or it can never be cured? Now, let's look at this. They say surgical repair, how to treat it. If conservative treatment fails, surgery may be considered to repair the torn tissue or retouch muscles. Recovery: with conservative treatment, pain may improve with rest, and a gradual return to activity can be planned. After surgery, most athletes can return to their sports between 6 and 12 weeks. Prevention program may be recommended for athletes at higher risk, focusing on strengthening the core and improving flexibility. A sports hernia prevention program may include exercises and stretches that focus on strengthening the core and pelvic muscles. So when you look at from what I read, mostly prevention is getting more rest, which means that Lamine Yamal game time might actually reduce, which means that they have to find a way of reducing his game numbers for him to at least try to live with this particular injury. Let me know your reactions on the comment. Say, is it really possible that this particular injury can never be cured or treated?